Hi, this is Dr. Woywood with Woywood Family Chiropractic. Thank you for coming here today to watch this video. And I want to talk to you today about wrist pain. Millions of Americans suffer chronic, recurrent wrist pain. And so I want to talk today about what causes it, how to prevent it, and how to treat it. First of all, what causes it? Well, it can be caused by use of cell phones and tablets, computers and game controllers, hammers, screwdrivers, playing the guitar improperly. All these things can cause wrist pain. And so let's look first of all at the primary motion that causes wrist pain, and that is extension of the wrist with deviation to the side of the pinky finger, the small finger. So that motion right there is what's going to cause your wrist to hurt. So if you're dealing with wrist pain, the first thing you want to do is avoid that. If you're not dealing with wrist pain and you don't want it, avoid that. So when you're using a screwdriver, for instance, you want to try to keep your wrist straight as you turn the screwdriver. Don't bring it to the side. When using a hammer, try to bring the hand down without flicking the wrist downward, because that will strain the wrist. Playing the guitar, keep the hand or the wrist straight as you play the guitar. Don't wrap it around the neck any more than absolutely necessary. Using the computer, avoid reaching out with your wrist extended to hit that enter key. Same thing with the mouse. Don't drag the mouse out to the side with your wrist extended. Try to keep your wrist straight as you move the mouse around. And if you do use your wrist to move the mouse, keep it minimal. You can, of course, adjust mouse sensitivity under settings. And then game controllers. Again, make sure that the wrist is not cocked off to the side and extended while you're using the game controller. Those things can all cause wrist pain. So what happens if you have it? If you have it and you've stopped doing that and you still have it? Well, stretches are the primary thing. So you make a fist and you pull your wrist down like this, pull your hand down to flex your wrist. Should be a comfortable, strong stretch. Hold it for about 30 seconds. The same thing, bring your wrist back like this and stretch it. Again, don't bring it to the side to stretch it, but just stretch it straight this way. And then stretch your thumb. These are some good stretches that can help relieve wrist pain. If that doesn't work, then we need to consider interventions, conservative interventions like chiropractic care. Chiropractors can adjust the wrist and elbow and relieve wrist pain. This combined with exercises to re-strengthen the muscles that work the wrist, which are all in the forearm, and stretching exercises, as I've mentioned. But the carpal bones right in here there are 9 carpal bones, and they actually can get out of alignment from wrist strain, and they need to be realigned in many cases. Now, non-steroidal anti-inflammatory drugs that you can buy over the counter, such as aspirin, ibuprofen like Motrin or Advil, or Aleve, which is naproxen sodium, they can help, but they also soften the joint tissue and can actually predispose it to injury. So you may want to look into some anti-inflammatory herbs such as boswellia, and you can find those in many places. And taken properly, those are very effective. Taken in a strong enough dose, those are very effective for problems like wrist pain. So if you live in this area and in the month of September want to come in and get a checkup of your wrist to see if there's anything we can help you with, we are doing that free of charge. Normally we charge $185 for the initial exam, but if you're having wrist pain or someone you know is having wrist pain, then get in here and let me check it out, because if it's left unattended, it can become carpal tunnel syndrome, which can be very difficult to treat. So if we catch it early enough, we can fix it. Don't let it get worse. So thanks again, and have a healthy, active, and fulfilling day.